it was just too much laughing for a podcast with an exorcist. First of all, okay, but it's pretty engaging stuff. And he goes in and talks about, well, we'll play the clip coming up later in the show. But that's on the way too this morning. Let's go into the KUAM News Zoom room where we have standing by Dr. Keith Horinuchi of the Wellness Clinic. Good morning, Doc.
Good morning.
We wanted to bring you on because we're hearing so much about the dreaded comorbidities and the even more dreaded multiple comorbidities. I mean, those are phrases we've been hearing since the beginning of this pandemic.
Mm-hmm.
And I guess we'll just start with, we're kind of talking offline, diabetes, right? When they list the types of comorbidities that people have, and they tend to fare not so well against the coronavirus. Diabetes is one of the top ones. And if you could, Doc, just explain to the audience, why is it that people with diabetes don't fare well when they get COVID?
Well, I think we first need to clarify, what regarding diabetes. What I mean by that is probably it's the diabetics who are uncontrolled that, might be having greater, side effects or serious hospitalization. So if you're a controlled diabetic, I think that's fine. They can be have a strong immune system to fight it like any other person. So just because a person's diabetic doesn't mean that they're going to automatically, have serious side effects.
But Doc, when you talk about controlled diabetes, are these, just to break it down generally, are these people who aren't on dialysis yet, maybe?
Well, when they're on dialysis, yeah, there was a point where they, for many years, they probably weren't controlled. I mean, even after dialysis, they could get back into control, so they had already lost the function of the kidneys, but they still, at any point in their life, they can still, achieve control, which would keep the inflammation down, which is probably one of the main reasons for having more side effects if they came across the virus, because inflammation is one of the main issues related to the COVID virus.
So how does it work?
How's it work?
The inflammation.
Well, we always talk about inflammation, as a major complication for a lot of health issues, for heart disease and cancers and, pain. So I think, and what I do in my clinic is I try to help people just to reduce inflammation in general. So we look at different kind of assessments. Just a simple test, high sensitivity CRP is a test that looks at inflammation. So a diabetic, typically because of the high sugars, causes increased inflammation, and it's not just in any particular area. It's throughout the whole body that there's increased inflammation.
I know you brought some slides with you, Doc. So if you want to go ahead and we can pop up these slides, you can talk about them.
Oh,
did you want to
I don't have them with me. Do you have them?
We have them, yeah. So go ahead. Yeah.
Okay. You want to just put some of them up there? I could.
Yeah, we'll just go in order.
Some of it.
We'll go in order, Doc.
But when we're talking about controlled diabetes, typically that's when a diabetic has their hemoglobin A1C less than 7.0, and when their fasting blood sugars are under 110. So I guess that would be like the point where one is controlled, or if they're not controlled.
All right. We do have this graphic here that you sent over, Doc, and it's methylation and sulfuration pathways. I don't even know what that
okay. Yeah, is that one coming up?
Yeah, sure. Yep.
Oh, Okay. That's a very interesting slide. I give a lot of my patients that slide there. It's the metabolic process of what we call methylation. Methylation is a chemical process that occurs in all the cells at a very high pace. And the result is to produce what we call a methyl group, which is basically it's just a carbon and 3 hydrogen connected to it. So if you remember chemistry, just a very simple molecule. But this methyl group is, as the term says on the slide, it is also connected to detoxification. And so when you make a lot of methyl groups, then you have a better, methylation helps with detoxing free radicals, heavy metals, even excess hormones. So it's one of the main systems to get rid of toxins. And so if you don't methylate well, then you're going to have an increase of toxins. And then the end result is going to be, damage to the heart, damage to other tissues, creating cancer. And part of that methylation is related to genes. So I think here in Guam, which probably in the whole world, there's a lot of people with some genetic SNPs. We call it single nucleotide polymorphisms, or you can just say it's a mutation to the gene. So it affects the production of methyl groups. And so in particular, I don't know if I'm saying too much, but in particular, it's related to just folate, vitamin B9.
Yeah,
One of the
vitamin
B
B9.
vitamins. Okay, we know that, right? Well, B9 is a common B vitamin that's found in our vegetables, and you can get it in a multivitamin. But the body needs to convert that to an active form. And I'm sorry, but get ready for this. The body needs to make L-methyl tetrahydrofolate. And you can see that on the slide. There's a MTHF. And this is needed to donate the methyl group into the methylation cycle, and then you can make the methyl group. So there's a blue box there just before the production of methyl tetrahydrofolate. And there's a lot of people that have this gene mutation. So it's difficult to convert folate into that. Okay, so the end result is there's less methylation and less detoxification. And then that's why there's more heart disease, especially if the gene is in the family. Yeah. Then there may be heart disease that runs in the family, or there might be diabetes that runs in the family, or there might be obesity. There's a lot of different things. This methylation also is important for making neurotransmitters like dopamine and serotonin. And so when somebody comes to see me for anxiety, we look at this methylation. I see there's a problem. They probably have a genetic factor involved. And so I give them as my supplement the methylfolate. So we bypass the genetic mutation. And then the anxiety goes away.
Now I kind of get what you're talking about when you talked about the genetics. And so, for example, like in my family, and probably a lot of families on my grandma's side, it's diabetes, right? And then on my grandpa's side, it's heart disease and stroke. So yeah, I feel like I'm living in a minefield.
Dr. Horinuchi, I have a question, if I may, because I was previously a caretaker for several years for my father, who had, fairly advanced diabetes, and he was on dialysis for several years. And kind of like what I learned from that is that, when you are on dialysis, typically they say you have to have a very often dramatically reduced fluid intake. And for me, I was like, okay, so you cut down the number of beverages you drink per day, but they were like, no popsicles, most fruits, you can't do because of the water intake. So I can assume that would be another very, very high risk for people that are susceptible to COVID, because, when they say, obviously, if you have a fever, you want to take lots of fluids, or, like the typical treatment and everything. So like if if it comes to that, people that are already susceptible, like what can the treatment be, just to address the symptoms?
So for the person on dialysis, well, yeah, there's a need to keep the fluid down because the kidney's not dialyzing, so you don't want to get edema and too much fluid in the body.
Yeah.
But I think the problem is not really the fluid. It's the control of the blood sugar, which is increasing the inflammation. That's where the real issue is. That they still need to manage their blood sugar. They need to make sure that they have good nutrition status. So even a person with dialysis needs to make sure that they can get some vitamin C, vitamin D, some zinc. Those are basics for boosting the immune system.
Mm-hmm.
So yeah, we need those nutrients. We need to make sure there's less toxins in the body. So that's difficult for the dialysis patient because they're hanging on to all their toxins until they get dialyzed. So they need to be careful with their diet, even though they say, well, I'm going to eat whatever I want. No, they really should be, still eating healthy, because it's just that the body doesn't remove the waste on a regular basis.
Mm-hmm.
So it still comes down to lifestyle, right? So healthy diet, don't overdo you're not supposed to overdo potassium and things like that when you're under dialysis.
Yeah, I at one point I was almost like a stockbroker, like checking the indexes and everything, because I was always looking at my dad's hemoglobin levels, potassium and everything like that, A1C as you said, and everything like that. I mean, I was just like looking at charts and knowing what the baseline was, and I can, I mean, my dad has since passed on, but I can only imagine like how much more stress that would put on the caretakers now in a COVID environment.
Doc,
sure. So that definitely is the comorbid, risk factor. Somebody's on dialysis, so they really, like I said, they really should be focusing on being more careful with the lifestyle, between dialysis sessions, because you're just building up the toxins, you're building up the inflammation. The high sugars are, lowering the immune system, all those factors.
Yeah, Doc, I mean, I don't know how many uncles, I mean, sad story, but they would be on dialysis and then, in between their dialysis days, they're just eating whatever, you know what I mean? With that mentality that, I'm going to get cleaned out tomorrow.
I wonder if there's data on those that have passed on with those were dialysis patients.
There maybe we can ask though. But Doc, there are other comorbidities that were listed, right? Like I believe hypertension.
Okay, a lot of hypertension is actually related to insulin resistance. So because you see diabetics and they have all the same health issues: high sugar, high blood pressure, overweight. And most of it's related to insulin resistance or the elevation of insulin. So insulin, when it's high, causes the body to retain more sodium. And so when you retain more sodium, you retain more fluids, and then that raises the blood pressure. So this is why, like a ketogenic diet, when you reduce the starches and carbohydrates, you're also reducing the insulin. And then the sodium goes down and the blood pressure goes down.
So for those people listening who, and we hear this all throughout the pandemic, where, just being healthy, right? Improving your health, improving your immunity is going to give you a better chance, should you catch the COVID. What are some things, I mean, even little things that people can do to kind of just get on that path before it's too late?
Well, of course, diet and exercise are critical. And the things that we should focus on in the diet, of course, are things like the basic vitamins that we hear about that are important for the immune system, like vitamin C, right? So a lot of fruits and vegetables with vitamin C, vitamin D is not really found in the food, so that typically needs to be taken as a supplement. And zinc, it's rather difficult to get enough zinc, so taking 30 milligrams of zinc a day is also really helpful.
Mm-hmm. Are these the kind of things, Doc, that people should only be taking when they feel like they might be? It's like, oh, okay, I got like a little bit of a scratchy throat, but like I'm not too under the weather. Just let me pop some like zinc. Or is this something that they should be taking like on a daily basis as ongoing preventive maintenance?
Yeah, definitely they should be taking it ongoing. Okay. So, as you know, I do sell supplements in my clinic, so I've seen a really big increase of sales for vitamin C, zinc, vitamin D. So a lot of people are getting aware of the benefits, and it should be something that we take every day.
Yeah.
Now, vitamin D is a fat-soluble vitamin, so that one should get tested periodically from the blood, and most doctors today are testing that. And so that should be within the optimal range. But many times I will recommend like 5,000 to 10,000 units of vitamin D to keep the immune system strong. Because most people today, when they're tested, are very deficient for some reason. Not sure why.
Sorry, Chris. I know, like, if you go on Twitter, and of course anybody who goes like online to try and look for medical advice instead of going to professionals like you're kind of like rolling the dice. But some people say that like if you were to take zinc like on a daily basis, so you can't build up like a tolerance for zinc, right? So then when you actually get to the point when you actually need it, you say it doesn't have the effect that it should because you've been taking it every day.
Yeah, you're not building an intolerance, but a high level of zinc is going to push down your copper level. So with a lot of things in nature, there's the yin and the yang. So zinc has an effect on copper. So those two need to be in balance. So sometimes if you take a lot of zinc, you need to also make sure you get enough copper because, too much zinc could be a problem.
Okay.
Well, Doc, it kind of sounds like multivitamins, yes or no?
Yes. But that may not be adequate enough, especially for the level of immunity that we need to, do in this situation. So usually I will recommend much higher levels of vitamin C, somewhere between 1,000 to 3,000 milligrams a day. Mm-hmm. Where a multivitamin, the daily recommendation is only like 60 milligrams.
Wow.
So that's only based on deficiency of vitamin C, which causes scurvy. So that's an old standard.
The scurvy. Yeah, we don't like it, the scurvy. Yeah, Doc. I mean, Sabrina over here is our vitamin C dealer. Every time we need a hit of that vitamin C.
That's actually
that
me.
You?
So,
I didn't know.
So, Doc, you'll be proud of us here on the show because like for the past like year or so, like I actually go out and I buy individual bottles of vitamin C, vitamin D, and zinc, and I wrap it up in like a little paper towel, and I give it to these guys every single day.
Oh, that's good.
Yeah.
Now you can.
But I was even thinking about that thing about the tolerance, and I was like, in so doing, just because I care about my coworkers, could I actually be?
Yeah, I never got one of these vitamin packs.
I always bring them to you.
Care about your coworkers.
Now you should think about vitamin C with quercetin or quercetin by itself. Mm-hmm. Quercetin is anti-inflammatory. It's also good for the lungs. The other one that's really very important is N-acetylcysteine, NAC. Have you heard about that?
All over the counter?
It's all over the counter, Doc?
Yeah. It's anti-mucolytic, so actually it's very helpful for the lungs.
Mm-hmm. Is this over the counter?
Treating COVID.
One more time.
Is this over the counter?
Yeah, it's over the counter. Cysteine is a precursor to glutathione. So if you recall what glutathione is, it's your main antioxidant in your body. That's also on the methylation chart that I showed.
Yeah.
Yeah. So cysteine is critical, and a lot of people do have liver issues. So cysteine is needed to support the liver detoxification. Those that have fatty liver and high liver enzymes probably are missing cysteine.
Wow, Doc, a lot of information. I think we got to kind of get you on semi-regularly to kind of go into a lot. I'm getting a lot of messages, people asking me to ask you about contamination that you find, because I know you do run a lot of tests, and I know some patients of yours, and they just got rave reviews about just some of the entry level kind of examinations that you do when someone becomes a patient at your clinic. So we'll fold you back into the show. I'd really love to hear what you have to say about just some of the
Be
contaminants.
glad to come back.
Thank you, Doc.
Okay, thank you.
Appreciate it.
See that, kids? Hulk Hogan was right. Eat your vitamins, take your vegetables, go see your doctor, say your prayers.
Right.
Yeah.
All right.
Very good.
Thanks, Doc.
All right, thank you.
All right.
Take care, Doc.
Dr. Keith Horinuchi. They're the Wellness Clinic.
That's good information.
Yeah, we had some good comments here.
Yeah, you guys take notes, and if you missed any of this, you can go back on YouTube and there's some real gems there that you guys want to know. Share with your family, please.
Yeah. Jun comments in, I like this doctor. He seems